Hey everybody, Dr. Connor Doherty here from Outbound Chiropractic. Today I'm going to be talking about the topic of hip pain, which is something that we see on a daily basis here at our office and we're able to get amazing results with. So first what I want to talk about in this video is how the medical community will usually treat hip pain if you go to see a medical doctor. Just to give you an overall idea of hip pain in general, hip pain is very, very common. It affects people of all different ages. And especially in the elderly population, it's up to 50% of elderly people experience pain in their hip on a daily basis. And then it's even in people younger, like teenagers and young adults, they experience hip pain very frequently too, from things like sports injuries and even things like our everyday just sitting down, whether it's sitting in school or sitting at work. That type of stuff really causes a lot of hip issues and can cause hip pain later on down the line. And what we have done, we did some research and we looked into how does the medical community usually treat hip pain. So what happens usually is when you go to the medical doctor with some hip pain, usually what will happen is they'll do an examination and they'll find out, okay, yes, sure, you have maybe limited range of motion or something like that, or sensitivity in that area. And usually what happens is the first thing they'll recommend some modification of activity, just allowing your body to rest a little bit. Then what they'll do is they'll usually give some sort of recommendation versus it could be NSAIDs, prescription of NSAIDs, which is an anti-inflammatory. And what that usually does is it'll suppress the inflammation that's happening in that area, which inflammation causes pain very, very commonly. So when that happens, that starts to go down, as well as they might perform some physical therapy, maybe some stretching, maybe some exercises just to kind of get that area moving a little bit. And even what's actually more and more common nowadays is they'll do steroid injections to really suppress that inflammation for a very temporary amount of time. Those are the four most common things that will happen if you go to a medical doctor with hip pain. And what we do is a lot more specific. What we know is that stuff is often very general, and it also can have side effects on areas outside of the hip joint. So with chiropractic, what we're going to be going over in the next video is how we have been able to get very, very great results, specifically working with that hip joint and the actual structure that is involved that's causing that hip pain. So hope you guys like this video. Please share this with anybody that you know that's been experiencing some hip pain, so we can get this word out. And be sure to follow us on Facebook, YouTube, and Instagram, where we're going to be continuing to put out more content like this. Thanks.